Every 40 seconds, someone in the United States has a stroke. For adults over 60, the risk doubles, even when you feel perfectly healthy. Most people think stroke strikes without warning, but that's not the full story. Your body often tries to warn you with small, fast signals, minutes, hours, sometimes days before a major event. If you know what to look for and act fast, you can change the outcome. I've spent years caring for older adults in clinics, hospital wards, and rehab, and I've seen the same pattern again and again. Today, I'll show you the 7 early warning signs of a stroke and the one action that can save a life: acting fast. Mark, 67, felt his speech slip for just a moment. His wife knew the FAST test: face, arm, speech, time, and called 911. He got treatment in time. 2 weeks later, he was back on his morning walk. Elaine, 72, thought it would pass. By morning, it was a full stroke. She survived, but needed months of therapy to say her favorite words again. The difference wasn't luck, it was speed. Here's our roadmap for the next 15 minutes. The science: what a stroke is, in simple language. The 7 warning signs: what they look like in real life. The FAST test: your quick action plan. Exactly what to do while help is on the way, and a prevention snapshot you can start today. Time isn't just money, it's brain cells. A stroke is a blood flow problem in the brain. When a clot blocks a vessel or a vessel bursts, oxygen can't reach brain cells. Without oxygen, cells begin to die in minutes. This is serious but not hopeless. If you recognize symptoms and call 911 immediately, doctors can reopen blocked vessels and protect brain tissue. Speed opens doors to treatment. The challenge is that warnings can be brief and painless. They can come and go, what we call a mini stroke, or TIA. Brief doesn't mean harmless, it means urgent. If any of these look off, even for a minute, don't wait to see if it passes. Call 911, let the emergency team come to you. It's better to be safe today than sorry tomorrow. Emergency teams do this every day. They want you to call. They would rather find you well than arrive too late. In the next section, I'll explain what's happening in the body during a stroke in plain English, so the 7 warning signs make instant sense when you see them. Stay with me. The next 20 minutes could help you save a life, maybe your own. In part 1, we saw that stroke doesn't strike out of nowhere. Your body gives warnings. Now let's look inside your brain and blood vessels to understand why those warnings appear. About 85% of strokes are ischemic strokes, caused by a clot that blocks blood flow to part of the brain. Imagine your arteries as highways delivering oxygen. When a clot forms, traffic stops. Within minutes, that area of the brain runs out of oxygen and cells begin to die. That's why every minute counts. Treatment can clear the blockage, but only if you act fast. The other type is hemorrhagic stroke, when a blood vessel in the brain bursts. High blood pressure is the main cause. The bleeding floods surrounding tissue and puts pressure on neurons. That's why people often describe a hemorrhagic stroke as the worst headache of my life. Though less common, it's more dangerous, but even then, fast treatment can save lives and function. When blood flow stops, neurons begin to die within minutes, roughly 2 million cells each minute. That's why stroke care is a race against time. The sooner you recognize the signs and call 911, the more of your brain we can protect. It's not panic, it's preparedness. Sometimes a clot blocks a vessel for only a few minutes and then clears on its own. That's called a transient ischemic attack, or mini stroke. The symptoms look identical to a stroke: numbness, speech slip, vision blur, but then they vanish. Don't ignore it. A TIA is your brain's warning flare. 1 in 3 people will have a major stroke soon after. The science is simple. When your brain's blood supply changes, your body changes with it. In your face, your speech, your balance, your vision. Those are the early warning signs we can see and feel. They are your first line of defense. If any of these appear, even briefly, call 911 immediately, because seconds can save brains. Now that you understand what happens inside the brain during a stroke, let's look at how your body shows the first signs on the outside. The sooner you recognize these, the sooner you can act. The first and most common warning sign is sudden numbness or weakness. It usually affects your face, arm, or leg, especially on one side. You might feel like your hand doesn't belong to you. You try to grip a mug, but it slips. You try to smile, but one corner of your mouth doesn't lift. Here's a quick test you can do right where you are. Raise both arms in front of you, palms up. If one arm drifts down or feels weaker, that's a red flag. This doesn't mean you're tired. It means your brain's motor signals aren't reaching your muscles. That's an emergency. Even if it clears after a minute, call 911, because a mini stroke today can become a major one tomorrow. Next, let's talk about a symptom that often starts as confusion, but can become deadly if ignored. The second warning sign is sudden slurred speech or confusion. This happens when the stroke affects the part of the brain that controls language and understanding. Sometimes the person can't find the right words. Other times they speak fluently, but the words don't make sense. Try this quick test. Ask them to repeat a simple phrase. Today is a sunny Sunday. If the words come out jumbled, slurred, or delayed, don't wait. You can also ask them to say their address or count to 5. If they can't or seem confused by the question, that's a stroke sign. Even if they're smiling, even if they say, "I'm fine," call emergency services immediately. They may not realize what's happening. The brain controls both speech and comprehension. When it's deprived of oxygen, words and clarity fade fast. Even if it clears, call 911. TIAs are warnings, not false alarms. Our next sign involves your eyes, and it's one many people ignore, thinking it's just fatigue. The third early warning sign is sudden blurred or double vision. It can happen in one eye or both. You may feel like the room tilts or a curtain falls over part of your vision. Some describe it as looking through fog or seeing two of everything. Here's a quick way to check. Cover one eye, then the other. If only one side is blurry, that's often a sign of interrupted blood flow to the visual cortex or optic nerve. This symptom can vanish quickly, but don't wait to see if it improves. A stroke in the visual centers can spread fast. Even if you can still walk, talk, or move normally, sudden vision change means get checked immediately. Vision problems are one of the most overlooked signs of stroke, especially in older adults who already wear glasses. But the difference is speed. When vision changes suddenly, that's your brain asking for help. So whether it's weakness, slurred speech, or blurred vision, the rule stays the same. Even if it clears, call 911. TIAs are warnings. In the next part, we'll look at 4 more early warning signs, the ones people often mistake for dizziness, fatigue, or aging, but that can mean something far more serious. We've covered the first 3 signs: weakness, speech changes, and vision loss. Now let's uncover 4 more that are often missed because they look like simple aging or fatigue, but they're not. They're your brain asking for help. If you suddenly feel unsteady, can't walk straight, stumble for no reason, or can't touch your finger to your nose, that's not clumsiness. It's a loss of coordination caused by reduced blood flow to your cerebellum, the part of the brain that keeps you balanced. Try this quick balance check. Stand with your feet together and close your eyes for a few seconds. If you start tipping or grabbing for a table, that's a warning sign. Don't brush it off as just dizzy. If this comes on suddenly, call 911. Remember, your balance is your brain's GPS. When it flickers, it's telling you something important. The next sign is a sudden, severe headache, often called the worst headache of your life. This is a classic signal of a hemorrhagic stroke, when a blood vessel in the brain bursts and bleeds. If you feel explosive pain that's different from your usual headaches, especially if it comes with neck stiffness, vomiting, or sudden collapse, call 911 immediately. This is one of the few times when waiting even minutes can cost a life. You cannot wait out a burst vessel. It's not panic, it's protection. The 6th sign is a drooping face or uneven smile. This happens when the facial nerve on one side stops receiving messages from the brain. Ask the person to smile or show their teeth. If one corner of the mouth doesn't move or one eyelid droops, that's a stroke sign. Even a slight asymmetry matters. Don't assume it's tiredness or a tooth issue. Remember, the face reflects the brain. If one side can't keep up, call for help. The 7th and final warning sign is one that fools many people: symptoms that appear, then disappear. These mini-strokes, called transient ischemic attacks, happen when a clot blocks blood flow for a few minutes, then dissolves. You might feel numbness, lose balance, or slur speech for a moment, then feel fine. But it's not fine. It's a warning shot. About 1 in 3 people who have a TIA will have a major stroke within days, often within 48 hours. If you or someone you love has any of these temporary symptoms, don't wait for it to come back. Go to the ER now. Catching a TIA is like stopping a fire when it's just smoke. These are your 7 early warning signs, your body's built-in alarm system. If any appear, even for a moment, treat it like a medical fire alarm. Don't ignore it. Act fast. In the next part, I'll teach you how to use the FAST test, a simple 4-letter formula that can save a life. You now know the 7 early warning signs, but when one appears, you have only minutes, not hours, to act. Here's the simplest, most powerful way to remember what to do. F stands for face. Ask the person to smile. Does one side droop or feel numb? That's a stroke signal. A is for arm. Ask them to raise both arms. If one arm drifts down or feels weak, it's a stroke sign. S is for speech. Ask them to repeat a simple phrase. Today is a sunny Sunday. If the words sound slurred or don't make sense, that's a stroke sign. And T is for time. If you see any of these signs, face, arm, or speech, it's time to call 911 immediately. If any one of these is positive, it's time to call. Don't second guess yourself. Act fast. When a stroke happens, the biggest mistakes come from hesitation. Don't drive yourself to the hospital. A stroke can worsen suddenly and you could lose control on the road. Don't sleep it off. Every minute you wait costs millions of brain cells. Don't take random pills or home remedies. Aspirin may help some clots, but can make bleeding strokes worse. Let paramedics decide. And most importantly, note the time the symptoms began. Doctors need that to know which treatments are still safe. Here's what to do in order. Sit somewhere safe. Don't try to walk around or reach for things. Unlock your door. That lets paramedics in quickly if you collapse. Call 911. Tell them you suspect a stroke and describe the symptoms. Stay on the line. Dispatchers can help you stay calm and guide breathing until help arrives. Gather your medication list if you can, but don't waste time searching. Even if symptoms improve, still go to the ER. Treatment windows can be as short as 3 to 4 hours for some stroke therapies. Never cancel the ambulance because you feel better. Your brain may not be done fighting yet. If you're a caregiver or bystander, you can make a huge difference. Record the exact time symptoms started. Write it down or say it out loud to the operator. If you can, take a short video of the slurred speech or weakness. That helps the ER team see how it started and judge how it's progressing. Bring an ID, insurance card, and any med list you can find, but don't delay transport. Stay calm. Your reassurance can keep blood pressure steady while help is on the way. Your calm can save a life. Acting fast is the single best way to limit damage and save a brain, but prevention starts long before an emergency. In the final part, I'll show you simple daily habits from food to movement to mindset that protect your brain for life. You've learned the 7 warning signs and what to do in an emergency. Now let's focus on what you can do every day to protect your brain, your heart, and your independence. I call it the 5P formula. Simple steps that can keep your blood flowing smoothly and your mind sharp. Check your blood pressure at least once a week. Keep it close to 120/80, or what your doctor recommends for you. Even small rises strain your blood vessels. Every point higher adds stress. Every point lower protects your brain. Your heartbeat tells a story. If it skips, flutters, or feels irregular, it could be atrial fibrillation, a common cause of stroke after 60. Ask your doctor about AFib screening. It can be life-saving. Fill your plate with color, fiber, and omega-3s, foods that clean your arteries and lower inflammation. Think of it as your daily medicine cabinet on a plate. Leafy greens, oats and beans, berries, fish, olive oil, each one supports circulation and brain health. Your emotions shape your blood pressure. Chronic stress, loneliness, and poor sleep tighten your vessels, silently raising risk. 10 minutes of calm breathing, connection with loved ones, and deep rest each night are powerful medicine. The 5th P is practice. These habits only work when they're consistent. Don't aim for perfection, aim for repetition, because small daily choices build long-term protection. Your brain loves movement. Just 30 minutes of brisk walking most days keeps arteries flexible and blood flowing. Drink 6 to 8 glasses of water daily. Hydration keeps your blood thin and prevents clot formation. You don't need a gym, you need consistency. Your next step, your next glass of water, is a vote for your brain. Stroke risk rises with age. Yes, but it's not inevitable. Your arteries can heal. Your brain can stay sharp. And your future can be stronger than your past. Awareness and action. That's your protection. You have more control than you realize. You are never too old to protect your brain, rebuild your health, and start again. If this video helped you, please like, subscribe, and share it with someone over 50. You could save a life, maybe even your own. Remember, know the signs, act fast, protect your brain, because every heartbeat is a chance to live stronger and longer. Thank you for watching, take care, stay strong, and I'll see you in the next video.